Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit, consumer-centered organization committed to fulfilling the health and residential needs of the communities across Massachusetts we serve. I'm your host, Jenny Sutherland, and with me today is a good friend of mine, Executive Director, Linda Manor Assisted Living, Emily Yaguccione, and you brought a friend?
I did.
Who do you have with you?
The lovely attorney Karen Jackson.
Welcome, Karen.
Thank you for having me. This is fun.
Well, I'm glad you came up to Pittsfield or out because you had to drive to the west from the center, from Northampton, Holyoke area.
That's right.
So thanks for coming out. And why'd you bring your friend along here?
Well, we wanted to talk a little bit about something that we had at Linda Manor last month on the CARE campus.
So you had a successful aging summit.
We did, and it was successful indeed.
Why don't you tell us what that event was about?
So what we did is a wonderful opportunity to partner with our professionals and resources in the community and provide health and wellness topics and different educational things to the people in the community and the residents and families.
Oh, that's fantastic. So it was a day of education.
Yes.
So about different opportunities, like Karen spoke,
Yes.
and how many people did you have speak, do you think?
Probably about 15 or 16 different folks that come in the community talking about all different types of things.
Oh, that's awesome. So Karen, you were talking about clearly law topics.
That's right, estate planning and elder law.
That's fantastic. And you had some other things going on too?
We did. We talked about foot health. We did the core exercise, strength, hearing problems that people might have.
Okay. And how was the community's reaction to that?
It was really well received. There's a lot of people that we had never seen before who were really interested in all the topics. And one of the most important feedback I got was people said they had a hard time picking which thing to come to.
Yeah, I looked at the
I
little
noticed that
registration
too. I saw people
form.
going, which way do I go now?
Yeah, and Karen was on, and then you had two other people speaking at the same time.
Yes.
Actually, my mom attended, and she wanted to go to all of them.
Yes.
Right.
So, and that's actually why I asked you to come on the show, was because I think these topics are important for people to hear about. And I know at different times throughout the year, there's opportunities at Linda Manor Assisted Living to bring people back. Karen, you've spoken there before.
Yes, it's such a wonderful service it's offered. There's such an important need for information, this wide variety of information that Berkshire Healthcare offers. It's extraordinary. It's really an attribute, it's just a wonderful benefit to offer the community.
And you like doing that for the community?
Oh, absolutely. And it's nice to partner with someone like Karen because people in all facets of their lives, they think, well, I don't think I need this right now. But really, there's really important to know at all parts of your life, whether you're caring for somebody or for yourself.
That's right.
And I have to say that's what, Karen, I heard you speak before at Linda Manor, and all the things that you spoke to, and we were geared towards the senior population, were important for me to think about for myself and for people in my family. So before we get to that, I would just want to ask you, one of the ways that I think you really excel and are great for the community is your way of presenting to the community. I think you really enjoy.
I do.
You like
and
that.
I love questions throughout.
Right. So
because that really helps keep the energy going, and it helps me to take the temperature of my audience. So I don't go ahead of them, but to really help them understand it, which is the whole idea of it.
So you don't mind coming out to Linda Manor and giving
No,
a
I love coming out to Linda Manor, and I have
Yes.
clients there. They really have a very good experience at Linda Manor. So
Well, that's good
I have
to
a
hear.
high,
I think
I have a
I'm
high
always
regard.
thrilled to hear that.
Very thrilled to hear that.
Right. So during your presentation, Karen, you talk about the big
The
five.
big five.
And I did it just like you.
Yeah.
The big
Oh,
five.
good.
I'm ready. I've
That's
seen.
like
Well,
the signature.
what's funny about it is when I graduated from law school, you'd think I was like smart enough, but I thought an estate plan was like death, and it was a will or a trust, whatever that was.
Yep.
But actually, of the big five, only one is about that, the will, but the other four die when the person who signs these documents dies. So it's to avoid going to probate court if the person loses their last marble while they're still alive.
Okay.
So every one of these other four documents are also really important. So that's the idea of the big five. It's like a safety net of jobs passed on to somebody else if the principal, the person who signs the documents, isn't able to know what they're signing or doing or whatever. We need substitute decision making.
Sure. And I think the first one I think is wills.
I have no order, but
You
if
have-
you
okay.
want to start with
well,
wills.
And the only reason I started with that one is I think that's the one that people when you talk about this, they'll say, well, I have my will done.
Well, that's good news. Only 30% of people have a will.
Okay,
so
but
I want everybody to have a will.
Yeah, and sometimes that's the only
Yeah.
thing that people think there are.
That's right.
And
that's
the
right.
most familiar.
And
But
I hate to say this, but I've seen lawyers who people think all they know about is a will, and they go to a lawyer and they ask for a will, and that's all they get.
Okay.
So it is important to get the word out. We need all 5 of these documents.
So why don't you give a little gist about all
Okay.
5? Because
Well,
it's important
since you
for
brought
everybody.
up the will,
Okay.
I have fun asking my crowds, like, what do you think happens if you die without a will? And a large number of times they say the state takes the money, or, you know, they just come up with a lot of wild stuff. But really what happens is the state writes the will for them. We call it the law of intestate succession. So I have a lot of horror stories about people who have died without a will. And even a young person, for example, I get calls, am I old enough to have a will? I say yes without asking their age. Am I rich enough to have a will? I say yes without asking their wealth. And I just have to give my students, my clients, one example that happens about once a year. About a year ago, I got another call similar to this one. Hi, Karen, you know me, I'm the personal injury attorney in Northampton, and you know about the such and such 25-year-old young man who suffered an automobile accident and lost his life. It was somebody else's fault, and over $1 million came into his estate. He died without a will, no spouse, no children. He thought no money. Well, now his estate has over $1 million, and so it's the state's will that comes into place. And the state's will, under that circumstance, or the law of intestate succession, said his 2 parents would get the over $1 million. And then the personal injury attorney goes on to say, you mean the deadbeat father who deserted him when he was under 2 years of age and never paid child support is going to get over $500,000 from the death of a son he never knew? Yes. Yes.
So the will's important, so the state and somebody else isn't deciding. And
right.
I mean, that was...
Strangers can receive an inheritance. Yeah, and a will is also important for who's in charge. If you get it's also the law of intestate succession. We call it priorities, and you could get like the worst, craziest, wackiest family member to be like in charge.
Well,
used to
that's
be called
motivating me to do mine, I have to say. I'm not sure who
So
would
will
do
gives you
that.
control over who gets your money and who's in charge.
Okay.
And young people who have minor children, that's where they name the guardian and guardian of their minor children. That's really important.
That's important too. And the other ones that follow up the will?
Here we go.
Yep.
The healthcare proxy, most people are very familiar with that. It's a statutory form, as we say. The form is handed out when someone has a day procedure, for example. What I don't like about statutory form is, first of all, it's hard for a nurse to help people, like help the patient figure out who really is the best healthcare proxy. So they fill it in, but the form in capital letters says optional for what I call a spare tire. So when I review these, often they don't have a spare tire. And if we lose the #1 agent, we're back to a guardianship, which is the whole point of it. I want a spare tire for every job.
Sure.
So the healthcare proxy is a springing legal document, meaning it springs alive only if and when a physician certifies in the medical records that the patient is unable to decide or communicate his or her healthcare decisions. Then the reins pass, and then we don't have to do a guardianship, which I've done enough of guardianships in probate court. It's such a tragedy for the families.
And,
So
and
that
I
avoids
think
a
in our
guardianship.
field we've seen that a lot too.
That's right, because someone needs to be admitted into a facility and they can't decide for themselves.
They're unable at the time
and the facility will say, well, let me see the healthcare proxy. They go, sorry, there is none. They go, get a guardianship. There's no choice.
And that, I think, doing things like that before, then you're picking who you want it to be. You
That
can have
too.
conversations
That's
with
right.
them about
Exactly.
things. And I think that brings you into the next, probably one in line of the
The
important
durable power of attorney
there you
avoids
go.
a conservatorship. And that's a really horrible probate matter that goes on year after year, like a guardianship. You have to do accountings every year, very expensive for attorney's fees and loss of work, and stressful with the appointed person, the conservator, having to go to court. And, you know, it's nerve-wracking for most people to go to court. So the durable power of attorney, I tell my clients, think back of what you've signed since you were an adult. As a competent adult, all the different legal documents you have signed your whole lifetime, that's what this replaces. I have the kitchen sink of power as my durable power of attorney, and so that allows the agent to then take over and sign things without having to go to probate court.
Yeah.
So that's hugely important. And as always, I want a #1 and a #2. It's a different job description than the healthcare proxy. The healthcare proxy is what I consider the hardest job. That's the 3 a.m. call, that's maybe making the decision on the advance directive is a document as well. It's very important, but it's pulling the plug or not. You know, it's a very, very serious job. The durable power of attorney, it's more like the business-like person in the family. It can't be the same agent for both, but it's a different job. It's a completely different job. It's paying the bills, it's signing in, taking responsibility, not personally to pay the bills at a facility, but to be responsible to pay the facility's bills from the patient or the resident's money.
And I'm glad you said that, because some people misunderstand. You're just the kind of the middle person.
That's right.
You're not taking over.
Yeah.
And I like what you kind of were saying. If people take the time to do this before it's a crisis,
Yes.
or where there's a lot of emotions involved, when people are going through these things, isn't the best time to pick.
Right.
And a lot of times they can't even. So if they take the time with you or someone else to figure this stuff out, I think then a difficult situation, you can just deal with the difficult situation without.
And it's not just about the right paper of the big five that we're working our way through. It's also, I help my clients choose the right agent. Like, for example, I had a client not too long ago who had 2 kids who were perfect in every way.
Of course.
Just to give you a summary.
Let me say that's
And
my
so,
mother as well.
Oh, my daughter, both would be great for everything. I'll have my daughter #1 for the healthcare proxy and my son #1 for the durable power of attorney. And of course, spare tire, right? You know me.
Yeah.
And then I knew to ask, well, do they get along with each other? Because they're in tandem, these jobs can be, like an admission into a facility. The healthcare proxy chooses a facility, but the durable power of attorney agent, we call attorney in fact, is the one who signs that financial responsibility I'd mentioned. So I knew to ask, well, does your son get along with your daughter? And she had to think about it and say, well, my daughter hasn't spoken to my son for 5 years. And I go, why is that? And she had to think about it. And she goes, oh, I remember now. He forged her name on a deed. And I said, he's fired. He's not touching your money. He's not close to your durable power. I want a Boy Scout or a Girl Scout for that job. This is your money while you're alive. And she said, okay, Attorney Jackson. Even though I said, call me Karen, I suddenly became, okay, Attorney Jackson. They don't always like my advice. So then the next day, she took it upon herself to call me and say, Attorney Jackson, I talked to my daughter and she's forgiven her brother. She hasn't forgotten, but she's forgiven him. And he's been sober for 5 years. I said, he's still fired. She said, I knew you would say that. I just want someone solid. I want, well, it doesn't have to be a child. It could be anybody. People think they're limited to people. Years ago, I've been doing this for 38 years, but years ago, they really did say, am I supposed to appoint my firstborn son? They used to say that to me like 20 years ago.
That's how
it's very different now, but they still sometimes think they're limited to a child or a family member. They're not. Just, it could be a neighbor. It could be Mrs. Smith next door.
So we are down, I think, to 2 left on the big 5.
Are we now? Thank you for keeping me on track.
I am.
The HIPAA release is very important. When a patient signs a HIPAA release in the doctor's office, it gives permission for the medical records to be shared with health insurance companies and other entities and people important to the physician. It doesn't mention the healthcare proxy. So my HIPAA release is very important, that it says the healthcare proxy and other entities and people have the right to have access to the medical records. That's really important. It's funny though, my clients, I always ask the same question. When I have a client who works at a major hospital, they'll say, we give the medical records without the HIPAA to the healthcare proxy. And they kind of have that tone with me. But my clients who work for doctor's offices, I always ask them the same question. They go, oh, no, go to probate court. We're not going to, we don't pass on medical records or allow any access without a court order. So it's very important to have the HIPAA, even if it's not always needed. It got elevated in my practice to part of the big 5. And the last one I briefly touched on, the advance directive. There's not one way to draft it. Like a person can go online, and there are lots of examples of the language or checking boxes, all sorts of things. I have worked over the years by working with my physician clients and hospice nurses, and I've created a simple paragraph that I build right into my healthcare proxy, so it's 2 documents built into one, because I had too many people say, oh, the hospital sent me looking for Dad's, if he had a living will and an advance directive, searching through his records, and and they keep the utility bills for 30 years, you know that. And so I built it in, and my basically says, my healthcare proxy is to do what I would want, And after consultation with my physicians, if it's determined that I'm in a terminal state or permanent vegetative state, and there's no reasonable expectation of my recovery, and most of my clients fill in the blank by saying, I direct that I be allowed to die a natural death and not have my life prolonged artificially. And then plenty of pain medicine, last sentence, follow these directions even if they might hasten my death or be against conventional medical advice.
Sure.
So that's the big 5.
And if people have questions for you or they want some help from you, how do they reach out to you, Karen?
They can go online. I have some articles that have been published in newspapers, and they can study, those articles where I go over the big 5 in one article. The only thing I don't like about that article that was published, I didn't get to pick the caption, and it said, I don't remember if it said the big 5, I didn't mind the first line, but then it said, who needs it, ? I would replace it, everyone needs it, !
Yeah, I think that should, out of everything that you shared with us, I think the important thing is everyone needs it.
Everyone needs it.
And if you can do it before.
Yeah, before it's too late, as they say, before something happens.
So you'll welcome calls, emails to reach out to you to get some help.
Yeah, call me, email me.
And I think we're going to watch for Karen to come back to Linda Manor Assisted Living and do some more events with you.
Absolutely.
All right. Well, Karen, thank you for coming on.
It's a pleasure. Thank you for inviting me.
Again, I could listen to you talk hours and hours.
Thank you.
We're going to take a quick break, and when we come back, we have another professional that was at the Successful Aging Summit. So thank you, Karen. You're going to watch a clip about what's going on at Linda Manor Assisted Living.
Nestled on 38 acres of pristine land, just minutes from beautiful Look Park and the offerings of downtown Northampton in western Massachusetts, Linda Manor Extended Care Facility offers you the best of both worlds. It's a locally run facility, staffed by dedicated healthcare professionals from the Pioneer Valley, and it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in Massachusetts. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Linda Manor is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Linda Manor, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice, and respite care services. We also provide services that fill specific needs of the community, like our Alzheimer's program dedicated to individualized care, maintaining dignity, and the highest quality of life for these residents. We proudly offer an elegant, home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Linda Manor is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident and patient at Linda Manor receives the highest quality care, delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Linda Manor Extended Care Facility, we're perfecting the art of superior care. If you or a loved one need short-term rehab, extra care after a hospital stay, or a nursing supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-586-7700. We look forward to meeting you.
Welcome back to InfoSource. We are talking about the Successful Aging Summit event held on the Linda Manor campus. And Emily Uguccione is here to talk about some of the professionals who are at the event. And now, what friend is this?
This is Dr. Ashley Mader.
Hello, Ashley.
Hello, thank you for having me.
Well, super excited to have you and Attorney Jackson on. Tell us what field of expertise you are, doctor.
So I do sexuality and aging. I have a master's in social work and a PhD in human sexuality. And when I was living in Philadelphia, I was doing a lot of work with older adults in a psychotherapy setting, running groups. And when I moved up to the Pioneer Valley, I decided to open private practice and only concentrate on sexuality and aging and helping older adults meet their sexual health goals, whatever that may be. And I decided to start writing and blogging. I have a website called Shine, Sexual Health in a New Era, and I write articles directed towards older adults and about healthy aging, healthy sexuality, and I have a private practice in both Amherst and Northampton.
And you had spoken prior to the Successful Aging Summit to a group of professionals at Linda Manor Assisted Living. And those people hadn't really ever talked about this topic. And you told them a couple things that we think of older folks in what ways?
So I always love talking to other healthcare professionals about sexuality and aging, because there's this idea that older adults are asexual. They're like that ship has sailed, that no longer happens. And so we have this kind of dichotomy of the sweet little old man or old lady or the old lech.
Yep.
So we have like the cougars and like the fairy godmothers. And we have the, the old lecherous, trench coat guy and the grandpa sitting in the corner just watching his John Wayne Western.
Yep. And I think that's when you got their attention. And I know for the summit, your topic was what?
It was on how to communicate with your healthcare provider about sexuality.
And what I liked was we were unsure. Emily was really you were committed to doing this topic.
Right. But it's not a subject matter at all or an audience that people are really comfortable talking about that topic at all.
And I think when you have people still living their lives and their bodies changing and relationships changing, whether you lose a partner or something or some health things, people still need to talk about it. And
Absolutely.
so I need to say kudos for you for having that topic at your summit. Kudos for the work that you do.
Thank you.
The couple things that you want people to know about senior sexuality.
I mean, the biggest thing for me is that seniors are still sexual. They're just, that doesn't leave. You're sexual from the day you're born until the day you die. However, sexuality changes. Frequency may change. How you express your sexuality may change. People who, they might have to redefine their sexuality in some ways. So sex doesn't always equal intercourse anymore. It can mean different things because there's different chronic illnesses that can prevent healthy sexual functioning, whether that be arthritis or high blood pressure, that can prevent some healthy sexual functioning. The other thing that I think is extremely important is about talking to your healthcare provider and healthcare providers talking to their patients about sexuality, whether that be the social worker, the nurse, the primary care doctor. It's just extremely important to have that line of communication open so they can talk about especially side effects of medication and just know what their bodies are doing and what's normal aging issues and what is could be detrimental or they need more help on. It's really important for both the patient and the doctor to communicate about that.
Yeah. So again, I'm thanking you both for the topic and for your work. If people want to contact you, you're online?
Yes, so my website is www.ourshine.org.
Okay. And you do some groups, you do individual?
Yes, I do groups, I do couples therapy. I also do a lot of workshops with healthcare professionals, whether that be in nursing homes, assisted livings, senior centers. In the past, I've done singles workshops in senior centers and just different sexuality workshops as well.
Well, thank you for coming on and talking about that. What a pleasure.
Thank you for having me.
And you'll come back again to the assisted living.
Absolutely.
I know
love
you're
to
a
have
good
you.
Yeah,
friend
it was so much
to
fun.
them. Yeah, and but it was a big group of people. How many folks did you have out there?
For the whole thing, we had about 60.
Yeah, for the whole day
Yeah.
of speakers. So I wish we could have everybody on. I'm glad Ashley and Karen came on and you were back. So thank you for that. Emily, always a pleasure to have you on. I thought you were going to talk more, but I took right back those reins, didn't I? All right. So I guess that's the show. So I'm going to say InfoSource is a presentation of Berkshire Healthcare Systems. Thank you for watching. I wish you good health and good life. Till next time.